Japanese encephalitis is a member of the flavivirus family, which is in the same family as dengue and Zika. All of these viruses are transmitted from one viremic host to a susceptible host by a mosquito. There has to be a mosquito in the pathway. They're maintained in wild birds. It's thought that they're largely maintained in a wading bird reservoir. But the other animal where they do amplify large amounts of virus within the body is pigs. So that's domestic pigs and it's feral pigs. And until very recently, in its southern distribution, it was confined to the very north of Australia. But then earlier this year, and probably starting at the end of 2021, there was a massive kind of southern expansion of Japanese encephalitis. And we think probably the virus came in with wild birds from the north, either from Asia or possibly from North Australia. And those birds with the virus began to settle in new freshwater habitats throughout the southeast. And where those habitats were in close proximity to domestic piggeries, then a lot of those piggeries became infected as well. And the disease's expansion and range was first noticed because of a large number of stillbirths in the pigs in those domestic piggeries. So that's how it was picked up. And now we have it all the way down the eastern seaboard, down through Queensland, New South Wales, Victoria, into South Australia. And we've got feral pigs which are being picked up with Japanese encephalitis in the Northern Territory and in northern Queensland again. So we now have a very, very wide distribution in Australia. Unfortunately, we've had about 30 confirmed cases, probably about 40 cases overall in the human population, and 6 deaths.
Of the people who get infected, generally speaking, roughly 1% develop some symptoms, and then of the ones who develop symptoms, about 30% can develop severe neurological symptoms and sometimes die from it. And of the ones who survive, about half will have some sort of long-term neurological damage.
We are extremely concerned. The fact is that we assume that the disease is now endemic, the virus is endemic. We had a La Niña over the last 2 years, and we're heading into another one now. So this brings very kind of wet weather pattern, and this creates the right conditions for mosquitoes to proliferate. They have lots and lots of fresh water to breed in, and also it changes the migratory patterns of birds.
We should be concerned. Once it's in the wildlife population, it's likely to return in the coming spring and summer.
It is the first time that we try to draw attention to the fact that we may have extremely large numbers of people who might be exposed. The reason that we're particularly concerned is that we're still not very sure how many people are actually at risk. If they are solely connected to piggeries, then we've done a recent calculation where we think that something like 800,000 Australians are possibly at risk. But we know that that's not the only potential source of the virus for humans. It could come straight from the wild bird population too.
This is being taken very seriously. There's been a coordinated response. And so for the pig industry is really devastating economically. You can have a virus going rampant into the herd and causing mortality and also stillbirths. The other consequence is the impact on the equine industry. It's quite debilitating and fatal disease. So about 50% of the cases will die. So far we don't have any confirmed cases in equine, which is really good news.
This is a vaccine preventable disease, and so any human death is a tragedy, and it is preventable.
The vaccines are very effective. There are 2 vaccines available in Australia, and they're both highly effective and very safe. Each state health department's website will have a list of local government areas that have been considered high risk. So people who live in those local government areas and spend a lot of time outdoors have also been prioritised for vaccination. To vaccinate, the entire population in the areas where we've detected transmission is not really possible because we don't have enough vaccines.
So this is Culex and neurosis. So it's the major vector we suspect of Japanese encephalitis in Australia, which is an extremely common mosquito of freshwaters. So it has an absolute Australia-wide distribution. So if they're not able to be vaccinated, if they can't get access to a Japanese encephalitis vaccine, then the only thing they can really do is protect themselves against mosquito bites. And in that case, our advice is, as usual, it's to wear a lot of repellent, especially around dawn and dusk when these mosquitoes are most active. Wear long sleeves, long trousers, cover your feet. As I say, the only thing that will protect you is not being bitten.